Coming up on MedWatch today, do you know the most common poisonous snakes in our area? We get up close and personal with the species while learning about how local toxicologists treat snake bites at the hospital while saving patients' lives from many common poisonings. That's still ahead. And tattoos may look cool, but do you know exactly what happens when that ink hits the skin? We talked to a local dermatologist about common skin side effects he sees in patients with tattoos and what you should know before getting inked up. And why that Halloween costume might give you more than a few scary looks. What experts are saying to do with your costume to protect you from germs before you wear it out for a ghoulishly good time. We'll tell you just ahead. Hi there, and thanks for joining us. I'm your host, Stephanie Bainham. We live near some incredible natural wonders here in our valley, being surrounded by national parks. And while exploring the great outdoors, one should always be on the lookout for potential snake bites. Luckily, there are people at community medical centers that focus on toxicology to help treat snake bites, along with common poisonings. We learned more by catching up with a toxicologist and taking a trip to the Fresno Chaffee Zoo. They're slithery, scaly, and their mere presence is scary to a lot of people. Snakes are the main event at the reptile house in the Fresno Chaffee Zoo, and it's here that the curator of reptology, Mark Halverson, is in charge of the reptile program.
Here in the Central Valley, we actually have a pretty diverse snake population here. The fortunate thing is there's really only one venomous snake that people need to be concerned about. That's the northern Pacific rattlesnake. But
we're talking about this one, a species you do not want to bump into on your next hike in the woods.
Whenever you see a rattlesnake, in the back of your mind, you should say, they're not in my backyard, I'm in their backyard.
Dr. Reyes Vora is a toxicologist and works in the Department of Emergency Medicine at Community Regional Medical Center. He helps to treat patients with snake bites at the hospital. He also teams up with the staff at the Fresno Chaffee Zoo to consult on anti-venoms and protocols for zoo staffers who work with venomous snakes.
it just makes sense to be a really close partner with your local hospital when it comes to when you're dealing with some animals that we have here. Not only the venomous snakes we have here, we do have other dangerous animals that potentially cause harm to keepers, and it's really good to have that relationship.
Besides being an expert on snake bites, as a toxicologist, Dr. Vora is busy in the emergency department, dealing with poisonings that can often involve small children and common household products.
Parents, please toddler-proof your house. Kids are geniuses at getting into things that they're not supposed to get into. They can circumvent just about any child-resistant or child-proof container there is, so you have to constantly be vigilant about how you can keep things out of reach, out of sight.
And if an accidental poisoning does happen from items like laundry detergents, cleaning products, or chemicals,
the first thing that they should do is call the Poison Control Center. That is a 24-hour free hotline that any parent can call.
And once your child is at Community Regional, they're in good hands.
So not every hospital has a toxicologist that will come to the bedside to help the patient whenever they have a poisoning emergency. All hospitals can access the Poison Control Hotline, but only Community Regional Medical Center has that service available at the bedside, and that's the only hospital in the Central Valley.
From ingesting harmful household products to snake bites, the toxicologists at Community Regional Medical Center have you covered, from the great outdoors to the indoors of your home. The number for the Poison Control Hotline is 1-800-222-1222. Flu season is here, and you need to not only be thinking about keeping yourself healthy, but also your little ones. We talked with a pediatric intensive care unit doctor about how to protect your kids from the flu and from other serious respiratory conditions. Dr. Adams, thanks so much for joining us today.
Of course.
And we are sitting here at the Pediatric Intensive Care Unit. What exactly goes on in here?
The pediatric ICU is where we take care of really the kids who get very sick, or the kids who need to be observed in case they get very sick.
And with the winter months coming up, there's a lot of talk about the flu, but also less talked about is RSV. What exactly is that?
RSV is respiratory syncytial virus. It's another one of the viruses that there are many of that cause breathing problems and cold symptoms in adults and children.
Well, you've had such great tips for us today. Anything else you want folks to remember?
I think it's very important that people remember to get their flu vaccine. It's very effective in preventing flu, and so we do recommend it for everybody 6 months and older.
Coming up on MedWatch today. Halloween costumes can be scary, but make sure they are not scary and germy too. Coming up, what you should be on the lookout for while trying on your Halloween costume. That's next.